The Makerere University Walter Reed project that was established in 2002 primarily for purposes of undertaking medical research in the development of HIV vaccines.
The U.S. military research program, known as MHRP, came to Uganda in 1999 with the goal of conducting HIV vaccine research. Originally, the work was started in Rikai Project, and work was done there for a few years. And then in 2002, the MUWRP was officially registered. So it's a program between Makerere University, and the funding for the U.S. military HIV research program comes through the Henry Jackson Foundation.
We do HIV vaccine research, we do research on Ebola vaccines, and we also conduct cohort studies that facilitate HIV vaccine research.
The work we've done together, I think, has made a huge impact on the field. We started with cohort research that helped identify the risks and incidence of HIV infection in rural Uganda, and very importantly, evaluated the subtypes in those locations and the difference in transmission and progression of disease according to those subtypes. But perhaps most importantly, we established a capacity to do world caliber research by Ugandans and for Ugandans.
In terms of vaccine research, we have successfully conducted 5 HIV vaccine studies, and a few of those have been published.
One of the studies that we conducted here, RV172, the 2 vaccines that we tested were tested further in the US in an efficacy trial.
Clinical research is not a very old thing in our profession, in our country. So most people are used to, going to hospital as patients. Now, training a doctor to conduct clinical research, training a nurse to conduct clinical research can also be a challenge.
The Vaccine Research Clinic has 9 spacious, fully equipped clinic rooms for procedures like consenting, counseling, physical examinations, vaccinations, and collection of required study samples. The MUWRP Clinic is charged with community mobilization and sensitization for HIV vaccine research, volunteer recruitment, and retention.
Our office as a community outreach has the mandate to provide a linkage between the research institution, specifically the researchers, the research work, with the outside community. The work that the researchers do need to be known outside the buildings where we operate. So in this way, we engage different stakeholders, we engage policymakers, we engage media, we work with the community where we get potential study participants. The idea of vaccine research and the whole biomedical research is not an old practice in our country. Some people don't appreciate it easily until you have a one-on-one interaction with them and then help them understand and appreciate the value of biomedical research. So at different levels of engagements, we have some challenges where people fail to appreciate that it's really important that we take on biomedical research forward.
We basically support the Walter Reed Clinic. So we support all the clinical and vaccine trials that are going on in the clinic, in that we process all the samples for all the volunteers that are recruited for each and every study. Our lab is divided into several sections. So we have a processing lab that is basically responsible for processing samples, and they're the first point of entry for samples when they come into the lab. We also distribute samples in which safety tests can be done for hematology or clinical chemistry, and from there samples also can go to the flow cytometry lab where we do clinical CD4s. The special thing about our lab is that it is a high quality lab. It has state-of-the-art equipment, and also we have our own liquid nitrogen plant, one of the very few labs in Uganda that are able to produce their own liquid nitrogen. Our lab is basically CAP accredited, which is accredited by one of the highest accrediting bodies in the US, the College of American Pathologists. So we have maintained our accreditation since 2005.
The other program we have is PEPFAR supported program. We support 3 districts, Kayunga District, Buvuma District, and Mukono District, to provide comprehensive HIV care, treatment, and prevention.
MUWRP has been working in Uganda to provide HIV care, treatment, and prevention services since 2005. The goals of the MUWRP PEPFAR program are to build the infrastructure, capacity, and systems of public and private partners in Uganda to ensure sustainable, high-quality, and comprehensive HIV services.
For many years, we provided care, treatment, prevention, and all PEPFAR activities to Kayunga. And then the district next door came knocking and wondered if we couldn't help them with their services. So we expanded into Mukono and Buvuma, and last year we added another district. So now we have comprehensive services, care, treatment, prevention, orphans, in 4 districts. So our goal has always been to support the Ministry of Health infrastructure as we felt those processes were already in place. And so our support has been in really supporting the district to provide these services to their populations.
PEPFAR basically delivers HIV prevention care and treatment services. We deliver a package which ensures that all HIV negative populations stay negative, and those who are HIV positive are initiated on HIV care and treatment. We offer safe male circumcision or voluntary medical male circumcision, which the UNAIDS and the Ugandan government found to reduce the risk of HIV acquisition by up to 60%. We also offer HIV counseling and testing, which is targeted. We mainly target most at-risk populations. Our target is to ensure that HIV positives are linked to HIV care and treatment.
In fact, MUWRP is our best performing partner. It has been with us for over 10 years. We have a lot of benefits. They offer services in different areas. They give us laboratory support. They also offer infrastructure development. They've remodeled Kayunga Hospital laboratory to one of the best labs in the whole country. They have remodeled Kayunga HIV clinic. In addition to that, they have also remodeled Bal Health Center for HIV clinic. They constructed a drying shed for Kayunga Hospital, and as we talk now, they're renovating Kayunga Lab because it's a hub for this region.
Kiseera kyali kitono nnyo ekibiina kya MUWRP ne kijjawo. Twebaza nnyo ebintu ebitali bimu bye bagenze batuwa.
Going forward, we are going to focus mainly on hotspots and subpopulations which we think are most at risk of acquiring HIV, like commercial sex workers, fisher folks, HIV negatives living in discordant relationships. This will ensure that we keep the negatives negative, and those who are HIV positive will be enrolled on life-saving antiretroviral drugs. HIV has ravaged our population, leaving behind orphans and vulnerable children. Through the PEPFAR funding, we manage an orphans and vulnerable children program. We identify children who are HIV positive and enroll them onto our program. We don't only enroll the child, but the entire family from where this child comes from. And basically our role is to ensure that they receive health care, they receive psychosocial support, and we ensure that they access education.
The third program is the Emerging Infectious Disease Program. This program conducts surveillance for influenza in animals and humans.
The surveillance activities are part of laboratory-based influenza surveillance networks around the world. This serves to detect local influenza outbreaks, provide isolates for the World Health Organization vaccine pool for vaccine component, and to detect any emerging strains that could be of pandemic potential.
We started as an influenza surveillance program, but we expanded into other emerging and re-emerging infectious diseases.
It was mainly established because of the threats of the avian influenza that was affecting the world at that time, specifically Asia.
We got the H1N1 pandemic virus, which spread very quickly across the world. From April when it was reported in the USA, we were able to detect it in July after a period of 3 months because of the capabilities which we had built.
Basically what we do under this project is to pick fresh fecal samples from the birds. We pick samples from the swine or pigs.
We collect samples from humans and test for influenza, screen for influenza. The reason why we take these samples is because of the One Health element, where infectious diseases have been reported to originate from animals.
For the past 6 years, we've collected data on influenza, and we've been able to note the trends of the various influenza subtypes that affect the Ugandan population. We also established a lab at Bombo and enhanced the lab from the lab it was to a biosafety level 1 lab. We are in the process of starting another study focusing on acute febrile illness, where we'll be focusing on various causes of febrile illness other than malaria.
And we will be doing this in about 5 facilities in Mulago, in Bombo, in Bwera, in Gulu, and Jinja.
Then the fourth program is the KESO program, and this program tests interventions for management of sepsis. Currently is planning to do a clinical trial to test an intervention for management of sepsis in collaboration with the Ministry of Health.
What we do in data is simply to take charge of data, to manage data. That's a very big building block of research that takes into account of data collection from the field or from the participants. Then that data is taken to the data processing unit where it is entered and analyzed to produce reports such that we inform decision making or policy formulation or to yield further research for the project.
The administration philosophy of operational efficiency has enabled MUWRP to achieve most of its objectives within its time of operation. Thanks to all our partners, volunteers and staff for getting us this far.
As the administration department, we are really very proud that we are part of each and every success that MUWRP has achieved, and we are glad we are associated with the primary goal of MUWRP, which is to mitigate diseases and to find solutions to human diseases.
The quality of the work has been outstanding. It attracts researchers and research collaborations from academia and corporations globally. I am very optimistic that this is an organization that will make its own mark in the research world and make contributions to the public health of Uganda and all of Africa.
We really want to thank the community that participated in research because they've continued to support the clinical trials as volunteers, and we really regard them as our heroes.
Always be faithful, use your protection, whatever rainy day, yeah, yeah. Mwekuwa kulinda, nadala abatomyaka, temu papa, atemu abafumbo, mukumo mwesigwa.